Hi, today we're going to talk about how our past has an effect on our neuroplasticity. There is something that has been documented by the name of adverse childhood events. You know, there are things in our past that sometimes were tremendously traumatic, and that can actually have an effect on our mental health. So, they have developed this quiz to try to identify some of those adverse childhood events. And by identifying them, we know if we have some of this on board. So let us go quickly through the quiz. Go ahead and answer and see where you're at regarding adverse childhood events. First question. Before your 18th birthday, did a parent or an adult in the household often or very often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? So this is something before your 18th birthday. Then the next question. Before your 18th birthday, did a parent or an adult in your household often or very often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? Again, yes or no. Next one. Before your 18th birthday, did an adult or somebody that was at least 5 years older than you try or did sexually abuse you? Question 4. Before your 18th birthday, did you often or very often feel that nobody loved you or thought that you were not important, or your family didn't take good care of each other, you didn't feel close to them, or they didn't support each other? Question 5. Before your 18th birthday, did you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, or you didn't have somebody to protect you, or your parents were too drunk or high to take care of you or take you to a doctor if you need it? If you notice, we're asking all these questions regarding the different aspects of the person. Next one, question 6. Before your 18th birthday, was a biological parent ever lost through divorce, abandonment, or other reason? Question 7. Before your 18th birthday, was your mother or stepmother often or very often pushed, grabbed, slapped, or had something thrown at her? Or sometimes often or very often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit over at least a few minutes or threatened with a gun or knife? Question 8. Before your 18th birthday, did you live with anyone who was a problem drinker or alcoholic or who used street drugs? Question 9. Before your 18th birthday, was a household member depressed or mentally ill, or did a household member attempt suicide? And finally, question 10. Before your 18th birthday, did a household member go to prison? So as you can see, these questions were proving about the past. And we can classify these adverse childhood events into 3 groups. You have what is called abuse, which can be physical, emotional, sexual. You have neglect, in which your needs were not taken care of correctly, your physical, your emotional needs. Or there was a lot of household dysfunction. There was somebody at home that was mentally ill. There was somebody that you knew very well that was incarcerated. You had your mother that was treated violently, or there was substance abuse that you witnessed, or you went through a household in which a divorce took place. All these things have an effect on the mental health. And you know, It's very interesting. The first time these adverse childhood events were proposed and documented was back in 1998. Dr. Felitti and Anda developed this questionnaire to try to understand childhood trauma. And what they did, they applied this questionnaire on 1,700 people that were what you would call privileged, mostly white, upper to middle class, college educated. They all had good jobs in healthcare. They got paid well, and because of that, they were able to live on a very nice part of town. And they were very surprised how these adverse childhood events were so common. In fact, the study that they published, they highlight 4 important results. Number one thing they found out is that these adverse childhood events are not some rare occurrence, but rather 66% of the people surveyed, which were these 17,400 people working in this hospital network, they actually, 66% of them reported having at least one of these adverse childhood events. So this doesn't necessarily need to be something, that low socioeconomic people have to face and so forth. The adverse childhood events, sadly, are in many places in today's society. Second finding they reported in the study is that if there was one adverse childhood event, there was an 87% probability that a second or more adverse childhood event was going to be present. In other words, adverse childhood events usually don't happen by themselves. So, for example, if somebody had sexual abuse, it doesn't happen usually by itself. Together with that, there seems to be other adverse childhood events that are happening in that type of household. Next one, the more adverse childhood events that are, the more likely the probability that long-term effects will happen. And that's exactly the reason why we are talking about this. See, those adverse childhood effects sadly can have a negative effect regarding neuroplasticity. And as we will see in a minute, the thinking changes, the self-worth changes, and so forth, as those traumatic events happen in the life of the person. And 4, adverse childhood events, they were able to document a fascinating relationship. When you start correlating how much does it cost for the healthcare of the person, how much the person is going to the emergency room department, how many mental health problems the person has, how much the person is getting in trouble with the criminal system, what they found out is that you could correlate the thing that predicted all these things, abstentionism, cost of healthcare, emergency department visits, mental health, criminal justice problems, the thing that predicted the most these costs and issues was not necessarily other factors, but rather adverse childhood events. In fact, they were able to follow up people, and they could actually predict chronic health type of problems, how people with more adverse childhood events tend to have more of these chronic type of health problems, status of the mental health, even their economic health and social health was related to these adverse childhood events. So, is there something that we can do if we have had these adverse childhood events? And the answer is yes. This program is actually a program to give you hope and not tell you you're hopeless, there's nothing you can do. Not necessarily. Even if we have been victim of one or more of these adverse childhood events, if we remember the principle we have been learning, the brain is plastic. So the brain can change. And as the brain changes, our brain can recover from these adverse childhood events. So what they were documenting when they published the results of these adverse childhood events is that they could predict, for example, how much healthcare you're going to utilize as an adult with how many adverse childhood events you had. In other words, how many doctor visits you're going to have, how many unexplained physical symptoms, which actually, if you work as a physician, you will learn that this is not something rare. This happens to be something common. Patient comes to see the physician, you do a complete clinical history, you do a physical exam, you order some laboratories, and when you're trying to piece together the symptoms that these persons are referring, somehow there is a disconnect between the symptom and what you are finding. You cannot explain, in some cases, why the person has those issues. And the thing of it is why these adverse childhood events affect us is because of the following. We have a loss of safety. You know, when you're growing up, as you get your physical and mental and physical needs met by loving parents, that creates a secure person. But when you live in a very unstable type of household where anything can happen, when you don't even know what you're going to eat tomorrow, the person doesn't feel safe. And you know that type of security and so forth is not there, and more probability the person will suffer anxiety and this type of problems. Next one, loss of danger cues. You know, how can somebody that you were supposed to trust hurt you, and this becomes the new normal? That means that you have problems trusting in others. And in fact, when something is going to be hurtful and so forth, you are just so used to being abused and so forth that you don't even are able to read that and kind of protect yourself. So the person loses those safety cues. And because those people that were supposed to help and support you, you were being abused by a family or a close friend of the family, you lose that sense of attachment. And you have a hard time trusting in others because others make you suffer and cause pain. The person has a hard time trusting in other people. And then you have this huge, overwhelming, debilitating shame. And the person grows up in an adult with this inappropriate shame is what we call it. And it goes through life feeling themselves guilty and so forth for something they shouldn't be feeling guilty. It is not their fault that they were abused. And that's why, as the person with these adverse childhood events tries to create links and tries to create friendships and relationships, there is this barrier that the person creates, and it's hard to really connect with your partner as the loss of intimacy takes place, or sexual behavior is misused just as a way of attracting and so forth, and not necessarily to cement the relationship. And then there is this disassociation that happens in order to cope with the pain and trauma that this child was happening. The child starts to disconnect from their consciousness what's really happening. So whenever the person is feeling overwhelmed and the person feels they cannot handle these things, that disassociation starts to take place as a way of defense. And because of that happens, there is actually a physical disconnect that tends to occur. And that's why these people that gone through these traumatic events have a hard time trying to connect, their body to what really is happening. So, for example, people that have survived this type of abuse, it's a long time that happens. They needed to go to the bathroom, but they didn't even realize until the very end, that's when they really need to go, and they end up, urinating or something on themselves and so forth. And one of the things that sadly that happens, their self-worth is harmed, and the person ends up developing, these feelings of being fake and so forth. And the person thinks that they're not special. The person thinks that sometimes it's better if they're gone and so forth. Or it's interesting how the opposite can also happen. The person builds this pride as a defense of what's had happened in their past, and they feel that they're unworthy to be loved and to be taken care of. And one of the things that we encourage our people that have gone through this is that they need to stop reacting this in their head. Many times, these traumatic events, the person runs the tape and repeats the traumatic effect over and over in their head. And sadly, instead of helping, it actually makes the thing worse, because as you are recreating the event, you actually sometimes add things that were not even there, and you make the thing even worse. So that's something we really put an emphasis. You have to stop playing this in your head. The more you play it, the more you hurt, and the more you revive that pain. Now, these adverse childhood events, let me share with you this statistic. This statistic is not a prophecy. It doesn't mean if you went through this is going to happen to you. But if you don't deal with this could trigger this in the future. For example, adverse childhood events, twice as likely as ending up with cancer, 460% more likely to ending up with depression, 20% more likely to be autoimmune, to be hospitalized with an autoimmune condition, 20 years shorten the longevity, and 360% more likely to ending up with heart disease. So as you can see, adverse childhood events not only hurt emotionally and cause trauma, but these adverse childhood events start manifesting themselves in the physical realm, increasing the risk of disease. So the reason why I wanted to talk to you about this is, number one, we cannot just ignore these things. You cannot just sweep them under the rug and say, oh, these things never happen and so forth. What we need to do, we need to come to God for healing. And that is what we have helped many people realize. You know, when we are hurting, God is hurting from us. Think about this way. Suppose that there are 10 family members. And you know, the parents have these 10 children. 9 of them are doing really well. They have their jobs, they have their spouses, families go well, but there is one of them from those 9 that is not doing well. It's involved with addictions, they cannot keep a job, the relationships are not well. Let me ask you this. From the 10 children, who are the parents constantly thinking of? Who they want to help? Who wakes them up in the middle of the night thinking about them? It is the one that is not doing good, the one that is constantly in the head of the parents. In the same way is God with us. Us that have had, difficult childhood and severe of these traumatic effects in our past, God is chasing us, wanting to help us. But, in love, you cannot force love. You need to open the door for then the healing to take place in your life. Because, if you don't deal with these adverse childhood events, your stress hormones inside of you are constantly in this alert form. And the stress glands secrete the stress hormones, and that one is manifested on the skin. It raises your blood pressure, it constricts your blood vessels, your muscles become spasm, and you can actually document these effects at the level of the body. But as we mentioned, there is hope for this. In an article that we published in the American Journal of Lifestyle Medicine, we are proposing that depression and anxiety have causes. And by identifying the causes of depression, you can reverse the depression. And one of those causes deals with these adverse childhood events. So we propose that by focusing on the other aspects, you can actually improve the overall health. And the thing of it is that for God, there is nothing impossible. As a bone that breaks, you don't just go to the doctor and the doctor's going to say, oh yeah, it's going to heal tomorrow. Don't worry about it. No, breaking a bone is something traumatic. It takes time. You need to set it up correctly. You need to go through that process of healing. There are some people that by themselves, reading books such as the book Steps to Christ. I highly recommend you read that book. That healing place start to take place. Some other ones are going to be in need of a professional such as a pastoral work, such as a Christian psychologist to help them go through that healing process. But the good news is that it can take place. And when we want to make changes in our lives, Dr. Prochaska from Harvard University proposes that there are 4 steps we need to go through in order to make positive changes in our lives. The first step is what is called unconsciously incompetent. Number 1, you don't know you need to make a change. Number 2, you don't want to make a change. But then you enter into stage 2 as you are listening to programs like this. You go into what is called consciously incompetent. Now you know you need to make change, but you're not doing the change yet. That is stage number 2. And then we go into the step number 3, what is called consciously competent. Now you want to do the change, and the change is not natural. In other words, for example, the reenactment that we were talking about, when you're playing the tape in your head. See, now you can choose not to play that tape. And in that way, you consciously choose the new behaviors and so forth. As you continue to repeat this, you will go into the stage number 4 that is called unconsciously competent, which means you're doing the new behaviors and you don't even think about it. They become part of you. So this is what we have found out in our program. As we identify the causes of the problem, we have these people that come to us with all these adverse childhood events, and they have this severe type of depression. By the end of our program, they ended up at the lowest level, which is the minimal depression. How can that take place? Because as a bone that is broken can be healed, our spirit can be healed. For God, there is nothing impossible. And you can see here, when the patient comes at the beginning of the program, some of them are severe depression, some of them moderate, some of them are mild, some of them no depression. By the end of the program, healing is starting to take place. And even thoughts such as suicidal thoughts, these suicidal thoughts happen when there is more of a severe type of depression. And you can see before the program and after the program how the suicidal thoughts start to decrease. This is in our medical residential program. You can see that about 50% of them have suicidal thoughts. By the end of only 10 days, suicidal thoughts have decreased dramatically as the healing start to take place. So we have documented this in multiple scientific studies, how it is possible, even if you grew up with an alcoholic, to conquer that. Even if smoking is an issue, you can conquer that. Even if substances such as marijuana and alcohol are on board, or benzodiazepines, these can be overcome. So that's why what we need to do, we need to start that healing process. That number 1 step is going to be to come to God and ask Him for help. And I can assure you, He is not going to let you go, and you'll start the process of healing.